Welcome back to the State House.
Thank you.
Lovely to see you.
Senator Rotundo, Representative Gatine, Senator Ingerson, Representative Meyer, and honorable members of the Appropriations and Health and Human Services Committees. I'm Justin Chenette, Sweetser's Chief Communications Officer. Today, I'm speaking in favor of the governor's supplemental budget, specifically the section in relation providing funding for the creation of Maine's first psychiatric residential treatment facility. Sweetser deeply appreciates the administration for providing leadership in acknowledging the plight of families and the lack of in-state care for Maine's most at-risk youth. The legislature, guided by your bipartisan recommendations from both of your committees, has demonstrated a clear commitment to making this project happen. In 2024, when DHHS put out a request for providers to create a PRTF, only one answered the call. Sweetser stepped up to meet the moment, and after being awarded the RFP last year, has been working collaboratively and diligently with various stakeholders to make this a reality. Currently, around 70 youth with the highest level of need are out of state to receive care as far away as Oklahoma because we are an outlier in not offering such a program here. 100 more youth are on a wait list to be sent out of state, and dozens languish in emergency rooms, sometimes even months on end, because there is no therapeutic place for them to go. Here's where we stand today on a solution, though. $2 million has already been appropriated by the legislature as a down payment to begin construction and start this program this year. $2.5 million will come from Sweetser, something you wouldn't find anywhere else or might be willing to do. This leaves a $3.4 million gap needed to complete this $7.9 million project, which is reflected in this supplemental budget. In this case, the supplemental budget represents both a moral document reflecting our shared goal of strengthening Maine families by keeping them together through the healing journey, and it also reflects our shared commitment to being fiscally responsible with taxpayer dollars, with cost savings from not building new, and reducing the estimated $30 million spent annually to ship kids out of state. Without passing this critical funding, Maine families from Kittery to Eastport to Madawaska will continue to see their youth shipped halfway across the country for more expensive care without the natural support of loved ones close by, or continue to languish in emergency rooms. Youth and families in each of your districts would benefit from such a facility and, frankly, deserve access to one. To recap, approving these one-time capital construction funds ensures that the state saves and keeps taxpayer dollars in state, strengthens oversight of facilities these kids are in by having it closer home, and keeps Maine families together by preventing family separation. This supplemental budget appropriation gets this project across the finish line. Together, we can truly build a home for hope and make a multi-generational investment in Maine's future. Thank you for your time, your leadership, and your continued efforts to ensure Maine's most at-risk youth get a fair shot at a brighter future and are not forgotten. Thank you.
Thank you. Good afternoon and welcome.
Thank you. Senator Rotundo, Representative Gatine, Senator Ingerson, Representative Meyer, and members of both the Appropriations and Health and Human Services Committees. I'm John McAnuff, and I'm the Sweetser CFO. I'm here today in support of the governor's supplemental budget as it relates to expanding in-state psychiatric residential treatment capacity. As you know, Maine currently lacks a psychiatric residential treatment facility, or PRTF, for youth with the most acute behavioral health needs. Sweetser has extensive experience operating intensive residential and psychiatric services. That experience has taught us two things. First, there is a clear clinical need for a PRTF in Maine. And second, these facilities are expensive to build, not because they are elaborate, but because they must be safe. Youth served in a PRTF present higher risks related to elopement, self-harm, and harm to others. As a result, the building itself becomes part of the treatment and safety plan. Construction costs are driven by requirements such as safety-first design of features and fixtures to prevent residents from hurting themselves or others, controlled access capabilities with high-tech security at all doors, 24/7 monitoring to ensure the facility is watched around the clock, durable reinforced buildings and specialized fencing to handle heavy wear and tear and to avoid climbing. In addition, these facilities require infrastructure enhancements, including upgraded electrical service with full generator backup, specialized ventilation and cooling systems, because operable windows are unsafe, fire protection upgrades, and full ADA accessibility. Many components also require specialized installation methods, increasing labor costs. Sweetser has been intentional about cost containment with our construction partners. This project reuses an existing building on our campus rather than pursuing new construction, which would likely exceed $10 million. We are retaining usable systems, selecting modest finishes, and making design choices that reduce cost wherever safety allows. Even so, the clinical and regulatory requirements of a PRTF create unavoidable capital expense. The safety, security, and evidence-based therapeutic environment are things we simply can't compromise on. The appropriation in this supplemental budget is important because it recognizes that these kinds of costs are a major barrier to expanding PRTF capacity. Without state partnership, nonprofit providers cannot assume this level of financial risk, and these facilities will not be built. Sweetser is interested in working collaboratively with the state to develop a PRTF that keeps children closer to home, reduces reliance on emergency departments and out-of-state placements, and fits within Maine's broader continuum of care. We view this as a partnership that must balance clinical quality, safety, and long-term sustainability. The nearly $3.4 million appropriation in this supplemental budget represents a thoughtful, targeted investment in Maine's children and in Maine-based solutions. Thank you for your time and consideration, and I would be happy to answer any questions.
Good afternoon.
Senator Rotundo, Representative Gatine, Senator Ingerson, Representative Mayer, and members of both the Appropriations and Health and Human Services Committee. I am Kristie Worster, Chief Program Officer at Sweetser. I'm here today in support of the governor's supplemental budget, and we deeply appreciate the administration's focus on prioritizing young folks' mental health. I would like to highlight two critical items: the remaining capital construction funding needed for the psychiatric residential treatment facility, which is included in the proposal before you, and the urgent need to stabilize children's residential care. The PRTF will be the first of its kind in Maine, a 16-bed, 8,000 square foot facility providing safety of an inpatient setting within a residential environment. The facility will serve youth ages 10 to 18 from all 16 counties who experience severe psychiatric crises, including suicidal behavior and trauma-related disorders. With 24/7 psychiatric and clinical coverage, children will receive the intensive care close to their families. Families will have access to a free family apartment, so if a family would like to be part of the healing journey, they can do so without worrying about cost, something that isn't afforded to them today, particularly if they have to fly out of state or travel out of state. While we explored cost-saving measures, such as reducing the facility size to 8 beds, fixed costs for safety systems, security, and the HVAC system remain the same regardless of the bed counts. Downsizing would only reduce the capacity and increase the cost per bed. This last remaining capital funding referenced in the budget will secure this project's completion. However, while we build hope for the future, we must also stabilize the present. Children's residential units, another critical level in the continuum of care, are currently on life support. Sweetser is one of only a handful of organizations still providing the traditional children's residential services. In the last 2 years, we have been forced to close 16 out of 32 beds due to staffing shortages and the lack of financial support. Over the past 3 years, Sweetser has experienced operating losses totaling $2.4 million in our children's residential care programs alone. This is not sustainable for anyone to operate, and strains are already in this fragile system. We know that the cost of a closed residential bed does not disappear. It simply shifts these youth to the emergency departments, out-of-state placements, and higher cost systems. Once the residential capacity is lost, it is extraordinarily difficult and expensive to rebuild. We ask that a short-term stabilization fund be included in the supplemental budget as rate structures that better align with the actual costs of running these programs are being pursued. Without an immediate stopgap measure to stabilize the remaining units, more units will close their doors. We appreciate the HHS committee for recognizing the difficulties within the current system, and we hope this can be included in the future iterations of this budget. By addressing both the long-term and short-term crises facing youth behavioral health programs, we can strengthen the system for every Maine family and every child in need. This is our collective moment for stepping up for Maine's next generation. Thank you.
Thank you very much. Are there questions? I see none. We appreciate your being here
Thank you.
with us today. Thank you.